So I just finished writing and filming a video about the failures of our healthcare system here in Canada, and this happens. This is just so sad. A 44-year-old man in Edmonton is dead. He went to the hospital because he was experiencing severe and persistent chest pain, the kind of pain that we're repeatedly told to never ignore. The kind of symptom that every public health campaign says requires immediate and urgent medical attention. And yet, he waited. He waited for 8 hours to be seen by a doctor, and he never did. He died before receiving the care he went to the hospital seeking. This is what people mean when they talk about socialized healthcare failing in Canada. Not as a concept, but as a lived reality. Access that exists on paper, but not in practice. Care that depends on wait times and staffing shortages, and frankly luck, rather than urgency and need. This man had a family, people who loved him, people who expected him to come home that day. And instead, they're left with grief and questions that should never have to be asked. There is no excuse for this happening in Canada, not one. Not in a country that prides itself on universal care. Not when someone goes to the hospital with chest pain, one of the clearest medical red flags there is, and is ignored and denied care. We are so often told to be grateful for this system, that criticizing it is unkind or ungrateful, that it's better than the alternative. But I don't know if this man and so many others would agree. The truth is, silence about our country's failures doesn't save any lives. Turning away from the problem doesn't fix it. Accountability does. Our government and our health authorities need to answer some very serious questions, and their answers better not be about more funding. A young man is dead because a system meant to help him failed him on the most basic level. We should not accept this. We should not normalize this. And we should absolutely be outraged, because if this can happen to him, it can happen to anyone. And until we demand better, it will keep happening.